Welcome back to the H's and T's. Now we're on the T's. This is tension pneumothorax. Tension pneumothorax. We will learn this semester, though we have not gotten to it yet. For tension pneumothorax, we provide a chest needle decompression. Needle decompression. Cardiac tamponade. There's very little that we can do in the pre-hospital setting for a cardiac tamponade. This patient needs to have a needle stuck into the pericardial sac to draw that blood out. That's not something that we do. It's called a pericardial centesis. So this patient needs to be transported. Give fluids enough to maintain blood pressure, but we don't want to give too much fluid because it can actually make the tamponade worse. Toxins. Now that's extraordinarily subjective because there's so many different things that somebody can be exposed to. So this would encompass your overdose patients. This would encompass poisoning patients. There's just a long list of what we could encounter with this. So you're going to treat the specific toxin if you can find the specific toxin. If it's a heroin overdose, then give some Narcan and ventilate the patient. If it's an organophosphate issue, then give some atropine and Tupam. So on and so forth. Coronary thrombus, i.e. heart attack, MI. We can give nitroglycerin. We can give aspirin. And most importantly, we can transport this patient to a PCI center. Pulmonary thrombus, PE. Same principle, we need to transport this patient. We don't thrombolize patients with PEs because we don't have a definitive way of diagnosing that. So these are some things that you want to think about when you encounter sinus bradycardia. The most important thing to remember about sinus bradycardia is that sinus bradycardia is not an arrhythmia. Sinus bradycardia is a sign or symptom of an underlying condition.